Good afternoon. My name is Anthony Sedano. I'm a registered nurse, and I'd like to take a few minutes just to talk to you about ways that you can reduce your risk of all-cause mortality by 20 to 30% in just 2.5 hours a week. So physical activity is one of the most important things that you can do for your health, both cardiovascular fitness and strength and conditioning. The World Health Organization has stated that physical activity is one of the leading causes of non-communicable disease and mortality. Lack of physical activity has shown an increase in all-cause mortality by 20 to 30%, and physical activity is one of the most important things that you can do for your health. Again, you can reduce your risk of all-cause mortality by 20 to 30%. You can reduce the risk of hypertension, heart disease, diabetes, certain types of cancer, stroke, all of this by just getting your basic levels of physical activity and strength and conditioning every single week. And we're going to go over some of that here this afternoon. So first is a baseline testing and screening. So if you want to get an idea of where you are with your physical fitness, there are a couple benchmarks that you should do to test your physical cardiovascular fitness and your strength and conditioning. The first is a 5-minute walk test, and that is pretty self-explanatory and simple. Try to walk for 5 minutes straight without stopping. If you can do that, that is a good baseline for your physical activity. Another is the treadmill test, the same as a 5-minute walk test, but if you can't go outside and all you have is a treadmill, 6 minutes on the treadmill, same thing, 6 minutes, no stopping. And it's a little bit longer for the treadmill just because you don't have to propel yourself like you do on normal terrain. And the last baseline benchmark for just strength is pretty simple. And again, it's 3 minutes of body weight squats. So just 3 minutes of squatting down. If you aren't comfortable with squatting, you could just get a chair and just practice sitting down in the chair, standing back up, sitting down to the chair, standing back up for 3 minutes straight without stopping. Those are the benchmark screenings for cardiovascular fitness and strength and conditioning. Now, the American Heart Association and the World Health Organization all recommend 150 minutes per week of physical activity. So what does that look like? That's pretty standard. Could be 30 minutes a day, 5 days per week, or 50 minutes per day, 3 days per week. Whatever one works for your schedule. That is moderate activity for 150 minutes. So moderate activity, some examples of moderate activity would be a brisk walk or a light jog, just walking for that 150 minutes per week will get you your physical activity for the week. That's all you need. If you wanted to do vigorous activity that wasn't moderate intensity, some examples of vigorous activity, you would need 75 minutes per week of vigorous activity, and that is running, cycling, rowing. A little bit higher intensity, and you need about half as much of that to meet the benchmarks for physical activity recommendations from the American Heart Association and the World Health Organization. Strength training is recommended to be done 2 times per week. So you should strength train twice a week. You don't always have to start, if you haven't worked out and you haven't been active, you need to build up to that 2 days per week, but you want to work all body parts, that is lower body and upper body. And you can do all of this at home. A great exercise at home is, again, just body weight squats, being able to do just sitting down to a seated position in a chair and standing back up. If you have mobility issues, you can use a chair or a desk or a cane, a walker, whatever assistive device that you use to assist you in that sitting to standing position. If you use the walker or a cane or any other assistive device, that will also help with the upper body strength and conditioning. So again, 2 days per week, try to hit all body parts. Some great examples of exercises you can do at home are those body weight squats, sitting down in a chair, standing up, just some routine standard lunges, going down to one knee, standing up, going down to the other knee, standing up. Push-up progressions are a great upper body workout that works to shoulders, chest, and arms. If you can't do a standard push-up, you can start on your knees. You can modify those workouts, do a few push-ups, and work your way up to get to that, strength training 2 days per week and working up to those benchmark exercises to get your strength training in. If you have difficulty in mobility and you can't walk, you can't do that, there are just the basic chair and desk exercises that you can do. Again, using the chair or desk to assist you in getting up from a seated position, or even just kind of bending down and pushing back up along the desk to try to work your upper body. You can also grab a gallon of milk, an old gallon of milk, fill it with water. 1 gallon of milk weighs about 5 pounds. You can do that and hold it and work up to do body weight squats with some added weight with that 5-gallon jug. You can get the 5-gallon jug and kind of curl to work your arms, push it up over your head to work the shoulders. Those are all great activities that you can do for strength training at home. No equipment required, just a chair, your body weight, and a gallon of milk, and you can do just about everything. So that is, my main wrap up for physical activity and strength training. It's very simple. It's not easy, but you can do everything at home, and you can do it in as little as 30 minutes per day, 5 days a week. Or, if you only wanted to work out and do your activity 3 days a week, it would be 50 minutes a day, 3 days a week. The key is getting that 150 minutes in, or 75 minutes of vigorous activity. And that would be the running, cycling, jogging, 150 minutes of the lower intensity, moderate activity, which would be just a brisk walk, or a very, very light jog. And the key with the moderate activity is, if you're on that brisk walk or a light jog, you want to be able to have a conversation with somebody maybe next to you. If you're working out so heavily that you can't have a conversation and still do that exercise, that's a more vigorous activity exercise. So you might want to dial that back a little bit. Some other things to consider with your physical activity and strength training is, if you become ill, if you get injured, if you just can't do it for one reason or another, and you kind of revert back to where you were before you started, the key is not to go right back up to that 150 minutes, the 75 minutes of vigorous activity, or the strength training 2 days per week. You want to build up slowly until you can get back to that. And so a good example of that is, if you can't do 30 minutes a day, 5 days a week, maybe you can only do 10 minutes of activity because you're sick or you had some sort of illness that had you hospitalized. You would do that 10 minutes per day, 5 days a week, and then a good example programming would be to increase that by 10%. So just add another minute a day, 11 minutes a day, the next time you go out, 12 minutes a day the next time, and keep doing that, going up by 10%, an additional minute or two per day until you get to that 30 minutes of activity 5 days a week. And that is, one of the most important thing that you can do to reduce your risk of all-cause mortality by 20 to 30%, death by any cause. And one of the biggest injuries that happen with older adults as well is falls. And that is just really typically walking downstairs and the inability for the legs to be strong enough to hold the body weight. So it's very important to be able to use your lower body. And you do that, and you will reduce your risk of death by 20 to 30%, and you'll live a much healthier life. Thank you.